Hello, nursing students. Today we are covering the vascular system, which is chapter 15 in our anatomy books. And in my book, I'm going to start reading on page 293. Fast fact. When the body is at rest, only 4% of the blood is in the heart. The rest is in the blood vessels. Of that, about 13% is in circulation in the brain. The vascular system of the average adult is more than 60,000 miles long, enough to circle the earth twice. Every organ, every tissue, and every cell in the body depends upon a continual supply of blood to provide it with oxygen and nutrients and to remove waste products. The body has an elaborate system of vessels, the vascular system, to meet this need. The demands on this system are great. It must penetrate every square inch of the body, from the skin surface to the deepest recesses of the internal structures. It must adapt to changes in body position from lying down to standing up or even being upside down. Changes in activity and changes in fluid volume. It must also work with the heart to keep the blood constantly moving. The framework of this system consists of 3 types of blood vessels. 1, arteries carry blood away from the heart. 2, veins return blood to the heart. And 3, capillaries connect the smallest arteries to the smallest veins. That makes sense. To remember the difference between the various blood vessels, remember A, arteries away. Arteries away, or the A. Arteries carry blood away from the heart. And C, capillaries connect. Capillaries serve to connect arteries and veins. And now I'm on page 294. Vessel structure. The walls of both arteries and veins consist of 3 layers called tunics. The basic layers include the tunica intima, tunica media, and tunica externa. The tunica intima, the innermost layer, is exposed to the blood, and it consists of a simple squamous epithelium called endothelium that is continuous with the endothelium that lines the heart. Its smooth surface keeps blood flowing freely without sticking to the vessel wall. This layer also produces chemicals that cause blood vessels to dilate or constrict. Tunica media. The middle layer is the thickest layer. Composed of smooth muscle and elastic tissue, it allows the blood vessel to change diameter. The smooth muscle in this layer is innervated by the autonomic nervous system. Tunica externa, the outer layer, is made of strong, flexible, fibrous connective tissue. This layer supports and protects the blood vessel. In veins, this is the thickest of the 3 layers. In arteries, it's usually a little thinner than the middle layer. Life lesson, aneurysm. The blood flowing through arteries is under high pressure. If a portion of the arterial wall weakens, the blood inside the artery will push against the weakened area, causing it to bulge. This is called an aneurysm. The most common cause of aneurysm development is atherosclerosis, combined with high blood pressure, although they may also result from a congenital weakness of the vessel wall, trauma, or a bacterial infection. The most common sites for aneurysms include the aorta, the renal arteries, and a circle of arteries at the base of the brain. If the aneurysm ruptures, massive hemorrhage will result. Even without rupturing, the aneurysm can cause pain and even death by putting pressure on surrounding nerves, tissues, and organs. Arteries, page 295. Arteries carry blood away from the heart. Every time the heart contracts, it forcefully ejects blood into the arteries. Therefore, arteries must be strong as well as resilient to withstand these high pressures. The arteries closest to the heart are the largest. As they travel farther away from the heart, the arteries branch and divide, becoming ever smaller. Finally, they become arterioles, which are the smallest arteries. Arteries can be divided into conducting arteries, distributing arteries, and arterioles. Conducting arteries. The body's largest arteries, these arteries expand as blood surges into them and recoil when the ventricles relax. Because of the large number of elastic fibers embedded in the tunica media, they are called elastic arteries. Example, aorta, common carotid artery, subclavian artery. So those are examples of conducting arteries. The distributing arteries. Okay, these arteries carry blood farther away from the heart to specific organs and areas of the body, also called muscular arteries. These arteries are smaller in diameter than elastic arteries. Examples would be the brachial, femoral, and renal arteries. And then there's the arterioles, and these are the smallest arteries. They're also called resistance vessels because although the contraction of smooth muscle, through the contraction of smooth muscle in their walls, they can resist the flow of blood, thus helping to regulate blood pressure as well as control how much blood enters an organ. They are too numerous to be named. Arterioles are connected to capillaries by short connecting vessels called metarterioles. Veins. Blood returns to the heart through veins. In contrast to arteries that branch and divide, forming progressively smaller vessels as they lead away from the heart, veins converge, forming progressively larger and fewer vessels as they lead back to the heart. Either way, the vessels closest to the heart are the largest. Veins are distinct from arteries in other ways. Because they aren't subjected to the same high pressures as arteries, the walls of the veins are thinner. Veins have a great ability to stretch, which allows them to carry varying amounts of blood with almost no change in pressure. Because of this great capacity for storing blood, they are sometimes called capacitance vessels. Veins can constrict extensively. This helps the body maintain blood pressure when the blood volume drops, such as from a hemorrhage. Large veins. Formed as medium-sized veins converge, these veins have a thick tunica externa. Examples would be the vena cava, the pulmonary veins, and the internal jugular veins. Medium-sized veins formed by the convergence of venules on their route toward the heart. Medium-sized veins have thicker, more elastic walls. These veins contain one-way valves formed from the thin endothelium lining. Valves keep blood moving toward the heart and prevent backflow. Veins in the legs, which must fight the forces of gravity as they transport blood to the heart, contain the most valves. Examples would be radial and ulnar veins of the forearm or saphenous veins in the legs. Venules. These are the smallest veins and collect blood from capillaries. The endothelium consists of squamous epithelial cells and acts as a membrane. The tunica media is poorly developed, giving venules thinner walls. They are porous and can exchange fluid with surrounding tissues. Capillaries. Capillaries are microscopic vessels that link arterioles to venules. More importantly, it's within capillaries that nutrients, wastes, and hormones are transferred between blood and tissues. These are the exchange vessels of the circulatory system. Properly functioning capillaries are as vital to survival as a properly beating heart. For this reason, no cell in the body is more than 4 or 6 cells widths from a capillary. Capillaries aren't evenly distributed, however. Tissues with high metabolic rates, such as the liver, kidneys, and myocardium, contain large numbers of capillaries. Fibrous connective tissues, such as tendons, have lower metabolic rates and contain fewer capillaries. Still, other tissues, such as the epidermis, cartilage, and the lens and cornea of the eye, don't have any capillaries. Fast fact, veins contain over 50% of the blood in circulation. In comparison, arteries contain 11%, and the rest is contained in the lungs, heart, and capillaries. Question. Veins are called capacitance vessels because A, they constrict extensively, B, they can stretch, C, they convey blood back to the heart, or D, they contain one-way valves. The answer is B, they can stretch. The ability of veins to stretch gives them a great capacity for storing blood. From this characteristic comes the name capacitance vessels. Okay, let's talk about the capillary organization. Capillaries are organized into networks called capillary beds. Connecting arterioles to venules, capillaries form what is called the microcirculation. And here about this picture, it says composed of only an endothelium and basement membrane, capillaries have extremely thin walls through which substances can filter. Capillaries have very small diameters, barely wide enough for blood cells to pass. As you can see, they're kind of lined up in this one, like coming through one at a time in this picture. The body at work. The body doesn't contain enough blood to fill the entire vascular system at once. During periods of rest, about 90% of the capillaries in skeletal muscles shut down. During exercise, when muscles demand an abundance of blood, the vascular system diverts blood from other areas, such as the intestines. At the beginning of each capillary bed is a precapillary sphincter that regulates the flow of blood into the network. During exercise, when skeletal muscles require more oxygen, the precapillary sphincters open. Blood fills the capillary network, and the exchange of oxygen, nutrients, and wastes occurs within the tissue fluid. During a time of rest, the precapillary sphincters close. Blood bypasses the capillary bed and flows directly into a venule to begin its journey back to the heart and lungs. Sinusoid. Some organs, such as the liver, bone marrow, and spleen, contain a unique capillary called a sinusoid. These irregular blood-filled spaces are more permeable, allowing for the passage of large substances such as proteins and blood cells. This is how blood cells formed in the bone marrow, as well as clotting factors and other proteins synthesized in the liver, enter the bloodstream. Capillary exchange. Capillary walls allow for a two-way exchange of substances and fluid. Capillaries release chemicals including oxygen, glucose, hormones, and nutrients that will be used by surrounding tissues. Capillaries take up waste such as carbon dioxide and ammonia. They also take up substances that need to be transported to other parts of the body. These include glucose, released by the liver, calcium, released from bone, antibodies, released from immune cells, and hormones released from endocrine glands. Water moves into and out of capillaries. Diffusion. In diffusion, the most important mechanism of capillary exchange, substances move from areas of greater to lesser concentration. What occurs is this: blood flows into the capillaries from the arterial system, carrying a supply of oxygen. Therefore, the concentration of oxygen inside the capillaries is greater than that in surrounding tissue fluid. As a result, oxygen diffuses out of capillaries and into the surrounding fluid. At the same time, carbon dioxide, which is more concentrated in the fluid of the surrounding tissue, diffuses into the capillary. Fast fact: capillaries make up in number what they lack in size. It is estimated that the body has over 1 billion capillaries. That's amazing. What a busy body we have. Okay. The next slide is filtration. Filtration and colloid osmotic pressure. This is page 299 in the book. Filtration, another method of capillary exchange, occurs close to the arterial side of the capillary bed, while colloid osmotic pressure operates toward the venous side. Of all the fluid filtered at the arterial end of the capillary bed, about 85% is reabsorbed at the venous end. The remaining 15% of fluid is absorbed and returned to the body by the lymphatic system, and this will be discussed in Chapter 16, Lymphatic and Immune System. So basically, blood enters the capillary through the meta-arterial. The pressure here is about 30 to 35 milligrams of mercury, mmHg, while the pressure of the fluid in the surrounding tissues is about 2 mmHg. The higher pressure in the capillary pushes the plasma and dissolved nutrients such as glucose and amino acids through the capillary walls and into the fluid in the surrounding tissues. This is filtration. Meanwhile, as the blood continues to move toward the venous end of the capillary, blood pressure inside the capillary drops to about 10 mmHg. The lower pressure allows proteins in the blood, such as albumin, to exert what is known as colloid osmotic pressure. In this mechanism, the albumin in the blood pulls tissue fluid along with the cell's waste products into the capillaries. Life lesson: edema. When fluid filters out of the capillaries faster than it's reabsorbed, it accumulates in the tissues. Called edema, this accumulation of fluid appears as swelling in the ankles, feet, abdomen, or face. It may also occur in internal organs. Edema has three main causes: increased capillary filtration. Because capillary pressure drives filtration, a rise in capillary pressure would increase filtration. Causes of increased capillary pressures include kidney failure, poor venous return from inactivity, or failure of the right ventricle, all of which allow blood to accumulate in the veins and capillaries, driving up pressure. Reduced capillary reabsorption. Capillary reabsorption depends on albumin. Therefore, a deficiency of albumin would slow reabsorption, causing edema. Albumin deficiency may result from liver disease because albumin is produced by the liver, severe burns, which allow protein to be lost from the skin surface, and kidney disease, which allows albumin to be lost in the urine. Obstructed lymphatic drainage. Because the body depends on the lymphatic system to absorb 15% of the fluid filtered by the capillaries, an obstruction here would cause fluid to accumulate. Besides an obstruction, the surgical removal of lymph nodes can also interfere with fluid drainage, leading to edema. Circulatory routes. Question. I'm going to read the question on the slide here. Capillaries release oxygen and take up carbon dioxide from surrounding tissues through the process of A, osmosis, B, filtration, C, diffusion, or D, colloid osmotic pressure. And the answer is C. Diffusion is the most important mechanism of capillary exchange. Substances move from areas of greater to lesser concentration. Okay, so now we're going to go to circulatory routes on page 300. In general, blood flows from the heart through arteries, then capillaries, then veins, and back to the heart. Typically, blood passes through only one network of capillaries before returning to the heart. An exception is the portal system, in which blood flows through two networks of capillaries. The body's main portal system occurs in the liver. Another exception is when two vessels join together. This is called anastomosis. An anastomosis may cause blood to flow directly from an artery to a vein, arteriovenous anastomosis, or from one vein to another vein, venous anastomosis. Anastomoses provide alternative routes of blood flow in case a blood vessel becomes obstructed. The body contains two major pathways of circulation: pulmonary circulation and systemic circulation. Pulmonary circulation begins at the right ventricle and involves the circulation of blood through the lungs. Systemic circulation begins at the left ventricle and involves circulation of blood through the body. Specialized circulatory systems include hepatic portal circulation, which routes blood from the digestive organs to the liver, circulation to the brain, and fetal circulation, because fetal circulation involves pathways that are only present before birth. This system will be discussed in Chapter 24, Pregnancy and Human Development. Pulmonary circulation. Pulmonary circulation routes blood to and from the lungs to exchange carbon dioxide for oxygen. It doesn't supply the lung tissue itself with oxygen. Those needs are met through systemic circulation. And so the book is listing these 5 steps, which are going to be shown in the animation. So I'm not going to read these. I'm going to let the robot do it, or the screen. Oh, hold on. I have to share the sound first. So let me do that. Like that.
Pulmonary circulation routes blood to and from the lungs to exchange carbon dioxide for oxygen. It does not supply the lung tissue itself with oxygen. Those needs are met through systemic circulation. Pulmonary circulation begins as blood leaves the right ventricle through the pulmonary trunk. The pulmonary trunk branches into the right and left pulmonary arteries, which enter the lungs. The pulmonary artery branches into lobar arteries, one for each lobe of the lung. These arteries branch into smaller and smaller arteries until ending at the capillary beds. The capillaries surround the alveoli, where the exchange of oxygen for carbon dioxide occurs. The capillaries form venules, which merge to form veins. The veins merge and finally form the pulmonary veins. Two pulmonary veins from each lung return oxygenated blood to the left atrium.
Page 301, systemic circulation. Systemic circulation supplies oxygen and nutrients to organs and removes wastes. This, of course, involves both arteries and veins. All systemic arteries arise either directly or indirectly from the aorta. The aorta, which originates in the left ventricle, is divided into three regions: the ascending aorta, the aortic arch, and the descending aorta. It branches into several major arteries. One, the ascending aorta, the first region, shown here, rises a few centimeters above the left ventricle. The right and left coronary arteries branch off of the ascending aorta to supply blood to the myocardium of the heart. Number two, the aortic arch, the second region, curves over the heart and turns downward behind the heart, making an inverted U shape right in there. The aortic arch branches into three major arteries. They include the brachiocephalic artery, which, through its branches, supplies blood to the head and the right arm. That's the only two places that the blood's going to go, to the brain and the right arm, from the brachiocephalic artery. The left common carotid artery, which extends into the neck, there we go, and the left subclavian artery, which supplies blood to the left shoulder and the upper arm. Oh, that's the left shoulder and upper arm over here. So that was this is the left one over here. That's right. This is the right and the left. So that's going to supply there. The third region is the descending aorta, and it travels downward dorsal to the heart through the thoracic and abdominal cavities. It's called the thoracic aorta above the diaphragm, and the abdominal aorta below the diaphragm. The abdominal aorta branches into the right and left common iliac arteries, which supply blood to the lower pelvis and the leg. Down here. Okay, fast fact. Arteries and veins are typically named for their location in the body, such as the femoral or axillary artery. The organ they supply, such as the renal artery, or a nearby bone, such as the radial or ulnar artery. Arteries change names as they leave one body region and enter another. For example, the axillary artery becomes the brachial artery as it travels distally from the body. The body at work. Each beat of the heart produces a surge of pressure that can be felt at points where an artery comes close to the body's surface. Perhaps the most common site used to measure a person's pulse is the radial artery in the wrist. However, pulses can be palpated in a number of other locations, including those shown here. The carotid, brachial, radial, femoral, popliteal artery behind the knees, the posterior tibial artery inside the ankle, and then the dorsal pedis artery on the foot. Okay, principal arteries. As previously mentioned, all of the systemic arteries arise either directly or indirectly from the aorta. The thoracic aorta and its branches supply the chest wall and the organs within the thoracic cavity. The abdominal aorta gives rise to the celiac trunk, which divides into the gastric artery, which supplies the stomach, the splenic artery, which supplies the spleen, and the hepatic artery, which supplies the liver. The renal arteries, which supply the kidneys, the superior mesenteric artery, which supplies most of the small intestine and part of the large intestine, the inferior mesenteric artery, which supplies the other part of the large intestine. The distal end of the abdominal aorta splits into the right and left common iliac arteries, which supply the pelvic organs, thigh, and lower extremities. Major arteries branching off of the iliac arteries include the internal iliac artery, the external iliac artery, the femoral artery, the popliteal artery, the anterior tibial artery, the posterior tibial artery, and the dorsalis pedis artery. Branching off of the aortic arch is the subclavian artery, which supplies blood to the arm, the axillary artery, which is the continuation of the subclavian artery in the axillary region, and the brachial artery, which is the continuation of the axillary artery and the artery most often used for routine blood pressure measurement, and the radial artery, which is often palpated to measure a pulse. Page 303, which is arteries of the head and neck. The brain requires a constant supply of blood. An interruption of blood flow for just a few seconds causes loss of consciousness. If the brain is deprived of oxygen for 4 or 5 minutes, irreversible brain damage occurs. Because of this critical need for oxygen, 2 arteries supply blood to the brain. Remember, arterial blood flows from the heart. So, to trace the path of blood to the brain, begin at the bottom of the illustration and work upwards. So, at about the level of the Adam's apple, each common carotid branches into the external carotid artery, which supplies most of the external head structures, and the internal carotid artery, which enters the cranial cavity and supplies the orbits and 80% of the cerebrum. The right common carotid artery arises from the brachiocephalic artery, and the left common carotid arises from the aortic arch. The vertebral arteries arise from the right and left subclavian arteries, and each extends up the neck through the cervical vertebrae and enters the cranium. Circle of Willis. On the undersurface of the brainstem, the 2 vertebral arteries unite to form a single basilar artery. Branches from the internal carotids and basilar artery form several anastomoses to create a circle of arteries at the base of the brain. The circle of arteries, called the Circle of Willis, helps ensure that the brain receives an adequate amount of supply of blood. The complete Circle of Willis consists of a single anterior communicating artery, 2 anterior cerebral arteries, 2 posterior communicating arteries, and 2 posterior cerebral arteries. So they're showing here the anterior communicating, the anterior cerebral, the posterior communicating, the posterior cerebral, and then the basal artery, the right internal carotid, the left internal carotid, the right common carotid, left common carotid, the left vertebral, the right subclavian, left subclavian, the brachiocephalic, and finally the aortic arch. That's coming right off of the heart. Okay. Principal veins, page 304. The veins drain blood from the organs and other parts of the body and carry it to the vena cava, which in turn delivers it to the heart's right atrium. The vena cava is the body's main vein. It's divided into either the SVC, superior vena cava, which receives blood from the head, shoulders, and arms, or the inferior vena cava, the IVC, which receives blood from the lower part of the body. Some veins, like the brachiocephalic, drain directly into the SVC, the superior vena cava. Others drain into a second vein, which may merge with still another vein before draining into the vena cava. For example, the axillary vein drains into the subclavian vein, which drains into the brachiocephalic vein, which then drains into the SVC, or the superior vena cava. Okay, the internal jugular vein drains most of the blood from the brain. In the right-sided heart failure, blood backs up from the heart and causes jugular vein distension. So that's something we can see just by observing the patient, that they're suffering from right-sided heart failure when we see their jugular veins distended on their neck. The cephalic vein at its distal end is a frequent site for the administration of IV fluids. The hepatic veins drain the liver. Because of its proximity to the heart, right-sided heart failure can cause congestion in the liver. A medium cubital vein is the most common site for drawing blood. The great saphenous vein is the largest vein in the body. It's frequently harvested for use as grafts in the coronary artery bypass surgery. In case there's a complete blockage in the heart, you'll need to reroute, and so they need to actually take a vein from somewhere else to create a new path in the heart, and that's the bypass surgery. The popliteal vein runs behind the knee. Fast fact: some veins, called superficial veins, reside near the body's surface, such as the veins on the back of the hand. Other veins, called deep veins, lie in deep, well-protected areas, often alongside bones and their corresponding artery. For example, the femoral artery and vein both run alongside the femur bone. Veins of the head and neck. Okay, and that's going to be on page 305. Most of the blood of the head and neck is drained by the internal jugular, external jugular, and vertebral veins. The internal jugular vein receives most of the blood from the brain as well as the face. The internal jugular vein merges into the subclavian vein, which in turn becomes the brachiocephalic vein. The brachiocephalic vein drains into the superior vena cava. The external jugular vein, the more superficial of the jugular veins, drains blood from the scalp, facial muscles, and other superficial structures. It too drains into the subclavian vein, and the vertebral vein drains the cervical vertebrae, spinal cord, and some of the muscles of the neck. Hepatic portal circulation. Unlike the veins of other abdominal organs, veins from the digestive organs and spleen don't empty into the inferior vena cava. Rather, they send their blood through the hepatic portal vein to the liver. This circulatory pathway allows the liver to modify the blood returning to the heart. For example, after a meal, blood glucose levels rise dramatically. This circulatory pathway allows the liver to remove excess glucose, which it stores as glycogen. Toxins, such as bacteria or alcohol, can also be partially removed before the blood is distributed to the rest of the body. Here's the specific route. Okay, rather than read all of the steps that are shown in the book, I'm going to just go ahead and let the link do all the talking.
Veins from the digestive organs and spleen send their blood through the hepatic portal vein to the liver.
This is pretty cool.
This circulatory pathway allows the liver to modify the blood returning to the heart, such as by removing excess glucose or toxins, such as bacteria or alcohol. Specifically, blood from the capillaries of the spleen, stomach, pancreas, gallbladder, and intestines flows into the superior mesenteric vein and the splenic vein. These veins converge to form the portal vein. Blood from the left and right gastric veins empties into the hepatic portal vein. The portal vein channels the blood into the liver. The blood is then distributed to innumerable microscopic sinusoids, which are the capillaries of the liver. The blood flows out of the sinusoids into the hepatic vein. From there, the blood flows into the inferior vena cava, where it is returned to the heart.
Okay, so we just watched this animation. This is the picture from the book. The next slide is giving us a question. The portal system allows blood to A, pass through 2 capillary networks before returning to the heart, B, pass through 1 capillary network before returning to the heart, C, bypass all capillary networks and return to the vena cava, or shunt blood from one vein to another. And the answer is A, pass through 2 capillary networks before returning to the heart. And the rationale is that blood normally flows through 1 capillary network before returning to the heart. But in portal systems, which occur in the liver, blood flows through 2 networks of capillaries. Okay, principles of circulation. So I'm on page 306 now. The purpose of the circulatory system is to deliver oxygen and nutrients to tissues and to remove wastes. A deficiency of oxygen or nutrients or an accumulation of waste products, even for a few minutes, can cause tissue necrosis, which is tissue death, and possibly even death of the individual. Therefore, it's imperative that blood constantly circulate or flow. Blood flows for the same reason that any fluid, including the water in a river or the fluid in an intravenous tubing, flows, because of the differences in pressure between 2 structures. This is called a pressure gradient. Fluid always flows from an area of higher pressure to an area of lower pressure. As the left ventricle contracts systole, it ejects blood into the aorta, producing a typical normal pressure of 10 mmHg. This is the systolic pressure. When the ventricle relaxes diastole, the pressure drops to an average of 70 mmHg, and this is the diastolic pressure. As blood moves away from the heart, blood pressure declines until in the vena cava it is about 1 mmHg. The greater the pressure difference between the 2 points, the greater the flow. However, as blood flows, it also meets resistance, and the greater the resistance, the less the flow. Therefore, to understand the flow of blood, we must consider these two factors, blood pressure and resistance. The body at work. The pressure gradient principle applies to blood flow throughout the entire body, including the flow in the organs and tissues. For example, pressure in the arteries and arterioles of the kidney must be higher than pressure in the capillaries and veins of the kidney for the blood to flow through the kidney tissues. The pressure gradient requires a certain balance, however. If the pressure gradient between the arterial and venous ends of the capillary network is too low, filtration won't occur. If it's too high, the thin-walled capillaries will rupture. Fast fact: the ability of arteries to expand and recoil with the force of ejected blood helps maintain certain pressure. Blood vessels expand to absorb the force of ejected blood and then recoil to prevent the pressure from dropping to zero. Blood pressure. The maintenance of a proper blood pressure, the force exerted by the blood against a vessel wall, is crucial for proper body functioning. Blood pressure is determined by three factors: cardiac output, blood volume, and resistance. Three factors that affect blood pressure. Cardiac output. When the heart beats harder, such as during exercise, cardiac output increases. When cardiac output increases, blood pressure increases. When cardiac output falls, such as when exercise ends or the heart is weak, blood pressure falls. Blood volume. When blood volume declines, such as from dehydration or a hemorrhage, blood pressure falls. To try and preserve blood pressure, the kidneys reduce urine output, which helps boost blood volume and raise blood pressure. Resistance, also called peripheral resistance, this is the opposition to flow resulting from the friction of moving blood against the vessel walls. The greater the resistance, the slower the flow and the higher the pressure. The lower the resistance, the faster the flow and the lower the pressure. Life lesson: blood pressure. Routinely, blood pressure, or BP, is measured with a sphygmomanometer connected to an inflatable cuff wrapped around the upper arm, the location of the brachial artery. The brachial artery is close enough to the heart that it reflects the blood pressure found elsewhere in the body. Arterial blood pressure is written as a ratio of systolic pressure, the peak arterial pressure during ventricular contraction or systole, over the diastolic pressure, which is the minimum arterial pressure during ventricular relaxation or diastole. A normal systolic pressure ranges from 90 to 120 millimeters of mercury, mmHg, while a normal diastolic pressure ranges from 60 to 80 mmHg. A lower than normal blood pressure is called hypotension. If blood pressure drops too low, blood flow to the organs is diminished, and if severe, can lead to shock and even death. Higher than normal blood pressure is called hypertension, is a major risk factor for heart disease, the chief risk factor for stroke and heart failure, and a cause of kidney damage. In fact, studies show that the risk of death from heart disease and stroke begins to rise at blood pressures as low as 115 over 75, and that it doubles for each 20 over 10 milligrams of mercury increase. Hypertension affects 67 million Americans, 1 in 3 adults. The difference between systolic and diastolic pressure is called pulse pressure. For a BP of 110/70, the pulse pressure would be 40 milligrams mmHg. Pulse pressure reflects the stress on the small arteries by the pressure surges during systole. Ranges for blood pressure. So normal is anything less than 120/80. Pre-hypertension is going to be like, maybe it's 120 to 139 over 80 to 90. And then stage 1 hypertension would be something that is between 140 and 159 over 90 to 99. And then stage 2 is going to be anything that's greater than 160 over 100. Okay, so now we're going to go to page 308, which is peripheral resistance. Peripheral resistance is the resistance to blood flow resulting from the friction of blood against the walls of vessels. The amount of friction depends upon the viscosity of the blood and the diameter of the blood vessel. Blood viscosity. Viscosity refers to the thickness or stickiness of blood. The greater the viscosity, the slower the flow. Likewise, the lower the viscosity, the faster the flow. Think of the difference between the speed of a milkshake flowing through a straw versus the speed of water. The chief cause of increased blood viscosity is an increased number of red blood cells, but it may also result from an increased amount of protein or albumin or dehydration. Vessel diameter. The muscular layer of arterioles allows them to constrict or dilate, changing the amount of resistance to blood flow. Because blood viscosity remains stable in healthy individuals, adjusting the diameter of vessels is the body's chief way of controlling peripheral resistance and therefore blood pressure. Adjusting the diameter of blood vessels is called vasomotion or vasomotion. A reduction in the diameter of a vessel is called vasoconstriction. Increases in the resistance to blood, it increases the resistance to blood flow. Because blood is being squeezed into a smaller space, pressure rises. Also, because the amount of blood allowed to enter the vessel is reduced, blood flow into tissues decreases. An increase in the vessel diameter caused by the relaxation of vascular muscles, also called vasodilation, decreases resistance to blood flow. Blood pressure declines and blood flow into tissues increases. The body at work. The elastic property of healthy arteries allows them to expand with each beat of the heart to absorb some of the force of the ejected blood. Then, when the heart's in diastole, the arteries recoil, shrinking their diameter. This expansion and recoil propels blood steadily downstream towards the capillaries. It also helps smooth out the surges of pressure that occur with systole, protecting smaller arteries. Because of their distance from the beating heart, capillaries and veins don't need to be protected from pressure surges. Consequently, blood in these vessels flows at a steady speed without pulsation. That's why an injured vein produces a steady flow of blood while an injured artery squirts blood intermittently. Fast-backed. Arteries become less elastic with age and absorb less systolic force. As a result, blood pressure rises. Arteriosclerosis also stiffens arteries and raises blood pressure because they're not as elastic. Okay, the next page is page 309. And we're going to talk about the blood velocity. Okay, the diameter of a blood vessel affects how fast blood flows, its velocity. The greater the diameter of the vessel, the faster the blood flows. The velocity of blood in the aorta is about 1,200 millimeters per second. In capillaries, it's about 0.4 millimeters per second. The fast flow is fastest in the aorta. Besides being the largest vessel, it's also close to the left ventricle. By the time the blood reaches the capillaries, it is slowed considerably, and that's because capillaries are far removed from the left ventricle. Friction along the way has slowed the flow. The smaller diameter of arterioles and capillaries has put up more resistance. The number of vessels has become greater, giving capillaries a greater total cross-sectional area. See, that makes sense on this page, which we will read in a moment. Blood flow through capillaries is slower than in any other part of the vascular system. This slow flow rate allows capillaries time to exchange nutrients, wastes, and gases with surrounding tissues. From the capillaries to the vena cava, velocity rises again, and that's because veins have larger diameters than capillaries, so they create less resistance. Many capillaries converge on one venule, and many venules converge on one vein, creating a smaller sectional area. That makes sense. To understand how cross-sectional area affects flow rate, think of a raging river. As the river travels farther from its headwaters, it begins to slow, both because it's farther from its source and because the friction of the water against the shore creates resistance. After a while, the river begins to branch repeatedly into a number of smaller streams, spreading water over a larger area. The flow rate into these smallest streams, like the capillary network, is much slower than the flow rate in the larger streams or the river. And that's because the water now covers a greater cross-sectional area. Then if these streams converge, like capillaries into venules and venules into veins, the water picks up speed as a greater volume of water is forced into a smaller space, a smaller cross-sectional area. The body at work. Changing the diameter of blood vessels also allows the body to redistribute blood flow according to its needs. For example, after eating, blood vessels to the skeletal muscles and kidneys constrict, while those to the gastrointestinal system dilate. This directs a larger amount of blood into the gastrointestinal system, giving it the blood it needs for digestion and nutrient absorption. When the digestion process ends, the body reverses the process to redirect blood back to the kidneys and other organs. The body can greatly alter flow in specific regions while general circulation patterns remain unchanged. Question: which condition would you expect to accompany atherosclerosis, a disorder in which arteries lose elasticity and fatty material builds up inside the vessels? A, irregular heartbeat, B, low blood pressure, C, increased blood viscosity, or D, high blood pressure? And the answer is D, high blood pressure. The accumulation of fatty material narrows the vessel diameter, leading to higher blood pressure, and a loss of arterial elasticity prevents the arteries from expanding with each beat of the heart, which also contributes to higher blood pressure. Regulation of blood pressure and flow, page 310. The vascular system can quickly adjust blood pressure and alter blood flow to respond to the body's changing needs. This occurs because of input from the nervous system as well as the influence of certain hormones. Neural regulation of blood pressure. The vasomotor center, an area of the medulla in the brain, sends impulses via the autonomic nervous system to alter blood vessel diameter and therefore blood pressure. Baroreceptors in the carotid in the carotid sinus and aortic arch, detect changes in blood pressure and transmit signals along the glossopharyngeal and vagus nerves to the cardiac control center and the vasomotor center in the medulla. Okay, so I'm going to go ahead and start this animation.
The vascular system can quickly adjust blood pressure and alter blood flow to respond to the body's changing needs. One way it does this is through input from the nervous system. Specifically, an area of the medulla in the brain, called the vasomotor center, will, when stimulated, send impulses via the autonomic nervous system to alter blood vessel diameter and therefore blood pressure. Baroreceptors in the carotid sinus and aortic arch also detect and respond to changes in blood pressure. Baroreceptors transpharyngeal and vagus center in the medulla. If the baroreceptors detect that the pressure is too high, the medulla will increase its output of parasympathetic impulses. Parasympathetic impulses cause vasodilation. Then the heart rate and the stroke volume also decrease, and blood pressure drops. If the pressure is too low, the medulla will increase its output of sympathetic impulses. Sympathetic stimulation results in vasoconstriction. The heart rate and the stroke volume also increase, and blood pressure rises.
The body at work. Baroreceptors mostly regulate blood pressure on a short-term basis, such as adjusting for changes in posture. For example, if you jump up after lying down, gravity will draw blood into your legs and away from your brain and heart, and you'll feel dizzy. When this happens, baroreceptors respond quickly to restore blood flow to the brain. However, baroreceptors aren't effective at controlling chronic hypertension. Now, at the bottom of this page, the table here speaks about how some of these hormones work that affect our blood pressure. I'm not going to read the details on how they work. I'm just going to let you know that there's 4 listed, or more than 4 actually, that cause the blood pressure to rise. So that's going to be renin, angiotensin 1, angiotensin 2, aldosterone, ADH, which is the antidiuretic hormone, and then epinephrine and norepinephrine. There's one hormone listed that causes blood pressure to fall, and that's ANP, atrial natriuretic peptide, ANP. Okay, so the next page is 311. Oh, I didn't read the body at work. I'm going to read that. Oh, yes, I did. Okay, venous return. After making its way through the arterial system, blood must return to the heart by way of the venous system. However, because gravity pulls blood into the legs and away from the heart, whenever someone stands, veins must fight the forces of gravity to deliver blood back to the heart. The only exceptions are veins in the head and neck, obviously. 2 key mechanisms aid in venous return: the skeletal muscle pump and the respiratory pump. So the skeletal muscle pump, muscles surrounding the leg veins aid in the muscle return, as you can see here. When the leg muscles contract, they massage the veins in the legs, propelling blood toward the heart. The valves in the veins ensure that the blood flows upward toward the heart and not backwards. When the muscles relax, blood flows backward, pulled by the force of gravity. and blood puddles in the vein flaps, keeping the valve closed and preventing further backflow. Respiratory pump. The process of breathing also promotes the flow of venous blood into the thoracic and abdominal cavities. During inhalation, the chest expands and the diaphragm moves downward. This causes pressure in the chest cavity to drop and the pressure in the abdominal cavity to rise. The rising abdominal pressure squeezes the inferior vena cava, forcing blood upward toward the thorax. Lower pressure in the thorax helps draw blood toward the heart. Valves in the veins in the legs ensure that blood doesn't flow backwards, unless you have defective valves, which could be genetic. Life lesson: aging and the vascular system. With age, blood vessels become less elastic, causing blood pressure to rise. In fact, blood pressure rises steadily throughout the adult years. Veins also weaken and stretch. This pulls the cusps of the valves apart, allowing blood to flow backward. The veins become distended, which leads to an increased incidence of varicose veins in elderly adults. And there's one more question here on the slides, which is, when blood pressure suddenly rises, which structure sends out parasympathetic impulses? Is it the medulla, the baroreceptors, the aortic arch, or the atria? And the answer is A, the medulla. Baroreceptors in the aortic arch detect changes and send signals to the medulla. The atria release the hormone the AMP, in response to high blood pressure. So that is all for this chapter. Please review the key terms and test your knowledge on your own. And thank you for your time today.